for our session in May to be in person as we look towards the strategic plan and during that event. And so we would love to have everybody present there and, see everybody again. And so looking forward to that. With that, we will go ahead and get started. And if I could ask Marnie to, do the roll call.
Absolutely. Good morning, everyone. Good afternoon. Starting with the roll call, Steve Balco.
Here.
Christina Box.
I'm here.
Senator Charbonneau.
I am here.
Deborah Fry.
I'm here.
Logan Harrison.
Here.
Ben Harvey. Doug Huntsinger. Michael Barnes.
Here.
Dan Raciniak.
Here.
Ken Sauer.
Here.
Ryan Tabor. Kara Veal.
I am here.
Great, thank you.
All right. Thank you, Marnie. Really appreciate it. So first item up for us today is the approval of the minutes from the meeting on December 9th. So those were sent out to everyone on Wednesday of this week. So I do hope that you've had a chance to review and look through them. And at this time, I'll ask a motion to approve those minutes unless there's someone that has a discussion point.
Yeah, this is Ed Charbonneau.
Yes.
And if I could, please, I just have a quick question on page 3 of the minutes. The fourth bullet point from the top. And the last sentence says, Dr. Maxey states that this funding cycle requires no federal match. I'm wondering if that should be no state match. And maybe I'm reading it wrong or.
I think it does refer to no state match for the federal dollars to be drawn down this year.
Yeah, it
Okay.
says there's no federal match. It should be state.
Okay. Thank you very much for catching that.
You're welcome.
Marnie, are you able to make that change for us?
We'll get that right away.
Great.
I'll make a motion to approve the minutes then with that correction.
I'll second.
All in favor?
Aye.
Those opposed? All right, great. So the next item up for us is some brief updates on the health workforce initiatives. And the first one is the license renewal for psychologists. And the Bowen Center has distributed the psychologist survey for council members in advance of the meeting. Hannah will lead us in a quick discussion of the proposed modifications. We look forward to your feedback during this discussion. So Hannah.
Thank you so much, Michael. I appreciate that. So just as a reminder for council members or anyone that is joining us from the public that's viewing, Senate Enrolled Act 223 from the 2018 session requires that data be collected from a number of health professions during their biennial renewal. And so this is just a list of those professions that are covered under the statute. And a quick reminder on Indiana Health Workforce Data Collection Initiatives. The Governor's Health Workforce Council serves as a review and approval mechanism for the surveys or the questions that are administered at the time of license renewal. These surveys, once approved, are submitted to the professional licensing agency for implementation in advance of the renewal cycles for each of the professions. Just as a reminder to council members, the values that guide the work to develop these surveys is minimizing the length of these surveys to reduce the burden on the licensing agency as well as, of course, on our licensees and professionals here in the state of Indiana. Also, to minimize the amount of free text, which reduces burden on licensees, but it also increases or threatens the quality of the data and makes it challenging to assess that data. And then minimizing gross changes to the survey tools to enable multi-year comparison. So any major modifications to the survey questions threaten the state's ability to look over time and to track trends when we make changes to some of those measures. So today we will be looking at the psychologist supplemental information fields that is in the survey tool. And a draft survey was distributed to council members in advance of the meeting, if you've had a chance to take a look at that. The survey that you were looking at and the specific, some of the specific feedback that was received came directly from the Indiana Psychological Association and the Indiana Council for Community Mental Health Centers. As another reminder, the Bowen Center does convene data advisory groups for each of the professions represented technically or representative of members of the occupations and trade associations as well as employers. So there were organizations that were invited to provide input and feedback. There were several proposed modifications that we have listed here on the screen. The first are modifications to questions 1 through 3. These are the questions that collect demographic information. These modifications are in alignment with the modifications the council has already approved to enhance diversity, equity, and inclusion of our data collection initiatives. Question 5, there was a proposed removing military training certification from qualifying for a psychology degree or credential. Although military training certificate had been listed on previous biennium, we have had 0 licensees indicate that they qualified for their psychologist license with this. And through advisement from the Indiana Psychological Association, it was determined that this is not a pathway to licensure in the state of Indiana for psychologists. So it's recommended that that be removed as an option. Question 10, there was also advisement to remove the reference to inpatient care to capture employment plans of all psychology professionals within the state. And then finally, questions 13 and 23, modify practice setting type language to align these with the Behavioral Health and Human Services Board. So there are instances where we would want to definitely be able to assess and do comparisons with our behavioral health and human services licensees and our psychologists. And then there are several more proposed modifications, and then I'll open it up for discussion. Question 24, we received feedback and guidance suggesting the inclusion of additional services that may be provided by licensed psychologists in the state of Indiana, and that may be important to track. The specific list was provided by the Indiana Psychological Association, including neuropsychological assessment, custody evaluation, forensic assessment, foster and out-of-home placement, gender health, LGBTQ counseling, pre-surgical evaluation, and vocational disability assessment. So there was a request to add these so that we may be able to track into the future our psychologists that are providing such services. Finally, on question 25, there was a recommendation to include some additional populations. Question 25 enables our licensees to identify the populations of Hoosiers that they serve as part of their practice. And it was advised that we consider adding veterans and healthcare workers as options in question 25. And then finally, question 26, this is simply updating the definition of telehealth to align with the new statutory definition. I'd be happy to take any questions or discussion on these. And then Mike, we can take it to a vote after discussion is closed.
the review of these questions and the ones that we've done in the past have been very instrumental in providing the right data to help drive decision making amongst agencies and funding and things like that. So these are vitally important, and I just want to give that tip of the hat to the Bowen folks for kind of continuing this work and curating it, and it is a primary function of this council. So any discussion points, questions, or concerns at this moment? Yes, Dr. Box.
So I just wanted to ask Hannah, is this a lot more questions than you have for other specific groups? Like, I don't remember answering 25 or 26 questions on this. Did this make this quite a bit longer for them? I do appreciate the inclusion. I'm glad that they weighed in on this and that they were more inclusive. I think that's awesome.
Thank you, Dr. Box. So actually, there are no additional questions that are being asked. These are
Okay.
modifications to existing questions. And so I will specify that it is similar to the physician survey tool. The reason that there are that many questions, there are up to 3 different practice locations that a clinician could provide that they practice at. So we
Okay.
recognize that some of our licensees, may practice at multiple locations. Those are licensees are able to bypass those if they only have one practice location. So I think that the total number of substantive questions is closer to probably 15, with the remainder being really focused on identifying and being able to geolocate our practitioners.
Okay, thank you.
No problem. I'll also state that Representative McNamara had indicated that she had some questions and interest in Indiana's ability to assess behavioral health services for individuals in the juvenile justice system. And so we were able to submit these modifications to this survey tool to her for review, and she had no feedback and indicated that they looked good and would be very helpful. So I would like to also offer that up.
All right, if there's no further discussion, I would like a motion to approve the modifications as have been presented.
This is Kara. I'll make a motion.
Thank you. Do I hear a second?
This is Stephen. I'll second.
Thank you. All those in favor?
Aye.
Aye.
I,
Aye.
Any opposed? All right. Thank you very much. Next, we're going to go back to Dr. Box and get an update on the state loan repayment program application.
Thanks so much, Michael. I really appreciate that. And I appreciate the work and the effort that the Bowen Center and the council has put into recommendations for the state loan repayment program, or SLRP as we call it. As you know, HRSA is broken down into the NHSC loans, which are federally, you apply for them at the federal level, and then the SLRP, which is a state loan repayment program, which we just prior to this mentioned this year there will be $1 million for that without a state requirement for funds to match that, which is really great. The considerations, which we're on page 13. I do want to just reiterate that we do always, when we apply, and the Indiana Department of Health will be applying for this opportunity to offer these loans or student loan repayments, basically we do that at the broadest level. So we always keep all professions eligible and all disciplines eligible, including all practice sites. We do have some focus now more on critical access hospitals. They do not seem to understand that they can apply for this, and we really do want them to have the support that they need. But also we, in the past, I think the last time we did this, we did mention specifically behavioral health disorder along with the primary care, which has always been a focus. But these are always open, and we will leave that broadly open. And the only other thing I really wanted to say about it is that we do have the ability, and this is really the only way you can apply, is to apply online. That SLRP application is actually online. You can actually fill it in online. The problem is that my team has to take the data and the information from that. If we want to know, say, everybody who applied for a primary care in a particular area, we have to download that and put that into kind of a spreadsheet. So there's a lot of mechanical handwork that has to be done. So we need an automatic download for that, which would give us more information about the people that are applying, the areas that they're applying for, the specialties that are applying for. So we are going to be working on that. But we're really excited about the ability to use the state loan repayment program to kind of cover those individuals that wouldn't be covered also under the NHSC loan repayment program, because they're going to go down to a score of 3 this next year, which is really a lot lower than the 18 for the HPSA that we've had before. And then for the state loan repayment program, we're not going to have a requirement for that, so that if somebody is 0, 1, 2, but they're going to be in an area that really is needed, or a particular profession that's really needed, we would be able to supplement with the SLRP. And I'm happy to answer any questions on that. And we want to continue, obviously, working with everyone. For instance, FSSA with regards to what they're doing from loan repayments and tuition reimbursement in the mental health, behavioral health field, and then also specifically in like workforce, the readiness grants that are available. We really haven't made a lot of use of that. So I think we really need to educate that there are those grants out there that we need our healthcare professionals. And that will be a part of educating all of our healthcare professionals, all of our healthcare professional students that are out there, and then working with employers and employers associations. Questions?
Thank you so much. Any questions for Dr. Box? It's really exciting to see this move forward, and it's going to be a great win for the state. So thank you for leading the way on that.
No, I think your teams have led the way, and I really appreciate that. And we're excited to be partnering with everyone. Thank you.
All right, great. Thank you. Next, we're going to talk about the long-term supports and services of direct care workforce initiatives, which is currently being led by Peggy Welch out of the FSSA. And so welcome, Peggy, and please give us an update. This is exciting stuff too.
Yeah, it is. Thank you, Mike. I really appreciate that. Thank you again for letting me come before you to give you an update. As you may recall, I was with you with Kim Opsahl in December. Just as a quick review, in early July, we started really focusing on this direct support workforce and what that meant for long-term supports and services. So as I shared with you when we were together in December, that in November, we very smartly began engaging Bowen Center, Hannah and her team. They jumped right in even before the contract was done, and they started right away working, and then officially started in the 1st of January. So they are deep into the development of our Indiana Direct Support Plan, which I keep saying will be the best in the country. If nothing else, we get to learn from the successes of other states and also the disappointments that other states have had, but also just the deep dive that we're taking and figuring out what we can do best here in Indiana. Just want to give you just these little highlights, and then I'm going to talk about the plan. And again, I'm talking very quickly and I'm using notes because I could talk for 45 minutes about what we're doing. So I want to stay on point. We are meeting weekly with the Bowen Center with Hannah and her team. We meet every Tuesday. We meet for about 30 minutes just to kind of dig into administrative stuff and check a bunch of boxes of things that we need to be doing. But we also then have every 3rd Tuesday, we turn that into a 1-hour meeting that we can really then take time to discuss exactly what we're doing. We were including our partners from Department of Health and also DWD in those 30-minute meetings, but it was kind of boring for them, but they definitely are engaged with us in that 1 hour meeting that we'll be having our first one of those this coming Tuesday. But that's Jan Kulik with Department of Health, Lisa Metcalf with DWD. And they've just become very engaged in helping us. Also, I have visited a couple times with Director Fry, just to keep her apprised of what we're doing and how PLA eventually will be engaged with us and maybe some of the ideas that we have. And then next week, I'm meeting with Dr. Nancy Holsapple with Department of Education. They are working on their graduate pathway program and they're developing a new program that has a focus on direct support. And so we want to be able to include all of that with what we're doing. And I'm kind of coming off a high because I had an hour's meeting, Mike, with your team, with your adult education leaders and ESL, because they're going to be very critical in recruitment and in training. So very excited about that and engaging with them. So let me talk about what term did we decide on, and it was fairly hard, but what we're referring to this pool of people that provide direct care, if you want to use that word, that they're personal attendants. We're calling them direct support workers. So let's talk about the plan, just again, high level here. Hannah and her team talk about internal environmental assessment. That's data and information. Looking at, as I think I even mentioned back in December, what's the current supply, the current demand, the future supply, the future demand, and lots of other data points that are out there that I don't really understand or know about, but Hannah and her team do, and they're gathering that information, and they're also working very closely with our data folks at FSSA and with some external data partners. So we want to make sure that we have lots of data to be able to answer questions that folks may bring to us as we're moving forward with the plan. Information, we need to know who are these Hoosier DSWs and what are all the different roles that we have in our Indiana HCBS world. So Hannah and her team did interviews with folks at FSSA about who are those people and what are the roles. And then they have been working very hard on asking, what are the federal statutes? What are the state statutes that affect DSWs? What are the rules and regs, administrative code? And my understanding is the grid that they're putting together, the matrix that's going to have all that around each role, will probably be the first of its type of a document in the country. And I think we'll be setting a standard of what other states can do in the collecting of that information and helping us make informed decisions. But one of the things I've asked them to do is to really be looking at using a lens of what of those rules, regs, statutes are barriers to recruitment, to training, to retention. And that may be some things that we'll be bringing forward in the future for consideration. Then Bowen Center, and as I said, Bowen Center is putting all that together. So that's kind of the information in that environmental scan. Input, that's the next thing. That it means people who are advising us from outside. So real excited to announce that we have formed our direct support worker advisory board. We have met twice. They are a lovely group of 17 women. I wish we had some males engaged with us, but so we are not gender diverse. But in every other way, we are diverse people from around the state, ethnicity, types of experience, length of experience. A fabulous group that are already giving us real insight into what they need and what they think is important that they can do their jobs better. We will, as I said, we've already met twice, and we're going to meet again with them on April 5th, because we just have so much that we really need to get from them as we're developing this plan. Also, part of that input is from other stakeholders. The LTSS group, they have a stakeholder list that they use, and they've given that to us, but with Bowen Center and others, we are expanding that greatly, because we want to make sure that we're not leaving anybody out of being engaged with us that may not care about the Medicaid and the other LTSS stuff, but they really care about workforce. So we're including Mike, a lot from your team that should be engaged with us, including Ivy Tech, including the folks from Department of Education and others. So we're going to be pulling that together. It is, and Hannah is the expert of this, but with this group, we want to have a big old stakeholder meeting and bring them all together to be able to share some of these promising practices, which we'll talk about in just a moment, and get their input on what we've already developed and what are other great ideas that we could have. So would be glad to talk more about that, but we're looking toward the end of April of having that meeting. So stay tuned about that. And then what we are doing is really looking at recruitment, as I said, training, retention, but also support. I think that's the fourth leg of what we're trying to do. And it's not, as I told the advisory board when we met last, I said, we're not here to take care of you and we're not here to help you. We are here to come alongside of you to help you be successful. And if you're successful, you will then be able to go to work and show up. And they really appreciated that. So we're looking at different ideas and ways that we can be supportive of them as we also look at recruitment and training and retention. So I think that's, and we're going to have a press release coming out soon, as it hopefully is approved by the governor's office, that we're making it clear that this is an essential group of workers. They're not just some folks that kind of show up and help take care of people. They are essential. They're an essential part of the whole healthcare team. And that's what we hear from them. They don't really feel like they're considered a part of the team. And we've got to correct that. So promising practices is another part that'll be of this whole plan. And we have, Hannah and her team have really been pushing to get collected from lots of different places. Again, from Department of Health, DWD, we're including Department of Ed and others, of what are these great ideas, promising practices, things that are working in other states that might work here. So we're, Hannah and her team have pulled together the ideas that they've received. They're organizing them. They're being reviewed right now by different folks. And that's what we'll present at that big stakeholder meeting, which we hope that will be at the end of April. And then plan development, it is the expectation, and Hannah keeps reminding me of this, that she will have this done mid-fall. We're pushing toward the end of September because we need to be able to, if there are things that we need to talk with the legislature about, we need to have that prepared for them. So that's that we're working on that. And then I think I may have mentioned this before, but something that's going to be real important to me as a part of this plan is not just all those great ideas, but how do we implement those ideas? So it'll be either part of the plan or will be an appendix that when we pull all that together, we will, my vision is that we will take each one of those ideas that we think are important to be able to move forward in those 4 areas and bring together groups of people that move from the idea to actual implementation. As I keep saying, if we all died, then somebody could pick that up and they could just start checking the boxes to make sure that we don't just put it on a shelf, but that it truly becomes implemented. We don't have a choice. It's critical that we move forward with the development of this workforce to meet the needs of those who are aging and also those who have disabilities, and let them have choices about what they want to do and where they want to be. So I'm glad to answer questions. I hope that gives you a quick idea of what we're going to be doing, and plan on including all of y'all in that stakeholder list, and inviting you to join us when we have that meeting, hopefully again at the end of April. Thank you.
Great, thank you so much. Any questions or? It's exciting stuff. Oh, go ahead.
Yeah, this is Ed Charbonneau. Peggy, I appreciate the 30,000 foot report. Let's go up to 60,000 feet.
Okay.
And what is the end point? I mean, what's the goal of this?
The goal is that we increase the number of people who are offering services as direct support workers. That we have a large, well-trained, available pool of people that can go into homes, can go into day centers, can work in group homes to be able to accommodate folks who are choosing to live at home or in community settings. So, but that's a lot of those pieces to be able to get to that end goal, that we have a bigger and greater and a well-trained workforce.
Okay, and I 100% agree with that. Do we know how many folks we need today and how many we're going to need 5 years down the road?
That is exactly what that data part is. There are federal data studies out there, and can kind of tell you, but I don't know that we have a real handle of what we need actually here in Indiana. And again, what is the current supply of workers? What's the current demand even? So what's that gap? And then what is the future look like? What are we gonna have to have, especially if the goal of the LTSS reform being led by, Dr. Rusiniak, is that the easiest and first choice is to be able to be at home. And so we that's important for us to know, because that kind of data is going to inform what we need to be doing. Dan,
Okay.
did you have anything you wanted to add on that?
No, I think you captured it really well. I think we'll need the data to get a better understanding, but it's also going to be, it's going to change every year as we see increasing demand. So,
Yes, and Dr. Rusiniak, you're well aware of Senate Bill 407 that we struggled with through the entire session. And I guess where I'm headed, we're not in a position right now to move forward with anything, because we don't know well, I guess we do know that we don't have enough DSW.
And Senator Charbonneau, one of the things that is very important is this workforce. Even if there was no reform going on per se that Dan and others have been leading, we have got to do something about workforce, because even if there's not this big change, people are choosing to stay at home, and we need more people, again, not only for home care, but also just for facility care. And I feel like that when we train up folks, it's going to cross many lines. And so hopefully we're going to be able to help with those folks that have a trained and larger workforce for facilities, as well as for home and community-based care. And maybe also come alongside of those family caregivers to help them also. So workforce is going to happen no matter what, or at least that's what I'm pushing for, because we don't have a choice. Does that make it a little more clear, Senator?
I understand what you're trying to do. Yes. Thank you.
And would love to visit with you and to answer more questions, and maybe some of your colleagues to help them understand how this plays into the reform and how it also stands alone.
Yep. Thank you.
Thank you.
So Peggy, we do have 10-year projections for all unique occupations within the state. And so we'll be sure to share those with you.
Well, and Hannah can tell you that she's working very closely with your folks.
Yep. Oh yeah.
And our FSSA team, we have such a strong data team collection and able to do the analytics. So Hannah, as I made it clear, this is all Bowen Center, but we're doing everything we can to provide other resources, as they have a heavy load that they're having to lift right now to get this done by the end of September. So thank you. I appreciate that, Mike.
All right. And we're a little bit behind, so unless there are any other questions, we'll go
I
on
think I
to.
see.
Yeah.
Oh, I'm sorry,
Actually,
Ken.
Yeah, this is Ken Sauer. Did have one question, and that is, do you have a pretty good idea of what kind of training would be appropriate, a model curriculum that you've seen maybe?
There's all kinds of programs out there. But I tell you, Dr. Sauer, again, having that meeting this morning with the adult educators, I've been talking also from the very beginning with Sue Elsperman. And I think we can do a pretty good job here. I envision bringing together from Dr. Holsapple and what they're thinking about at DOE, all the way up to Ivy Tech, putting them in a room and developing a continuum. We've got to provide a foundation certification that we were talking about that today, of anybody that would be interested in doing direct support should have that certification of just the basics, and then developing and giving them hope. After somebody may just stay here, but they've got hope that they can even eventually earn an associate's degree and maybe go on to a bachelor's degree, depending on what their interests are. So I can't give you details about that. There's lots of programs that are out there, but how do we make sure that we look from the beginning all the way to an endpoint that is going to help them be successful?
Okay, sounds good. And certainly the Commission for Higher Ed would love to be involved in that April
Right.
meeting. Very good.
Well,
Thank you.
and I appreciate that, because I think that's real important of all doing. And so we'll be doing that. Obviously, talking mostly with Sue, but that engagement, but we need your help. So thank you, Dr. Sauer. I appreciate that.
Yeah, thank you.
All right, thank you. Next, we're going to move on to ask Dr. Box to give us an update on the Public Health Commission.
Okay. I did not know I was doing that, but I am more than
sorry.
happy to do that. That's okay. I must have missed that, but we have had, of our 6 work streams that we're working on, we've done 5 of them already. Our next one will be this next week, and that will be around emergency preparedness. We've been meeting since last September. We have already done our infrastructure and services. We've done our funding. We have done adolescent and childhood integration, data, information and technology analysis and integration. And there's one more that I'm forgetting, but I'm sure I'll pick up with it here in a minute. But honestly, they've gone very, very well. We will be spending April and May going back over each of those topics, highlighting again the major issues or concerns that were brought up. Or we could do this, we could recommend this or that. And we'll be putting that together in a document in June, and all of that will be voted on in a very public and transparent process with the Public Health Commission. We have been doing visitations around things. Oh yeah, it was funding and workforce. It was the workforce part, sorry. But we have been doing stakeholder engagements. I think we've done 27 of them now, Senator Kinley and I, with Association of the Commissioners across the states and the county councils and other people, businesses, healthcare professionals, et cetera. And we'll continue to do those through the summertime. We have also been doing listening tours around the state. We've completed 3 of them. Our next one is this Friday. From 11 until 1, and that will be up in Huntington. And that is truly just a listening tour where individuals, maybe they're associated with the schools or with the public health or the hospital association or elected officials or local health department, could be just the general public comes and tells us what they believe to be issues, concerns, or things that they want to get on record about public health. So as Senator Kinley's been updating Senator Charbonneau, I just had the opportunity to sit with Senator Charbonneau and Senator Kinley this week and do a good update. And we've been updating Representative Barrett, who is also then the head of the Health Committee in our House of Representatives. So it's been going very, very well. We're getting really good feedback from everyone, and we'll continue to keep you guys updated, and then looking toward recommendations for the governor for 2023 legislative session.
Great. Thank you so much.
Yeah.
And then I think the last on our list of updates here is if Senator Charbonneau wanted to provide any updates from the legislative session.
I guess just a couple of things, and I know it's short time, but a couple of items that we did that I think are very significant and very significant from a workforce standpoint and a needs standpoint. And I would describe as the most significant workforce development bill that we dealt with this session. Thank you. Oh my golly, getting a phone call at the, I apologize, but that bill really should expand the ability of training in Ivy Tech and the other higher education institutions that have nursing programs to expand their enrollment. And I certainly didn't realize that we were graduating close to 2,000 nurses every year and losing ground, because IU Health can use all of them, and that would leave everybody with nothing else. But that one, I think, is, again, from a workforce standpoint, the most significant bill that was dealt with this session. And workforce was the number one issue that going into the session. Telehealth, we did version 2 of telehealth, which was the next step as we expand the ability to use telehealth. And I think it will be a huge help in the mental health area with the community mental health centers. And it's just a great next step expansion, but a very, I think, calculated expansion to make sure that we do this in steps and don't affect the quality of care. Did a number of interstate compacts and licensure bills, reciprocity bills, Medicaid coverage for school nurses, which was another big issue to deal with from the healthcare standpoint. And I think finally we had a bill dealing with home health care, and it was Vanita Becker, but it was to make sure that the folks that are involved in home health care have at least a little bit of training and understanding of dealing with people with dementia. And they go through these folks go through a 75-hour, I think, training program. And the bill would just say part of that training program needs to be understanding how to deal with dementia patients. So that was quick, but looking back, we did a lot of significant things that sometimes you have to look backwards to see what was done, because I came out of it initially feeling not so good. Well, feeling not so good about a whole lot of things, but the healthcare. And you look back, we along with Dr. Bach, Dr. Raciniak, and everybody else, were able to get these bills across the finish line. So thank you.
Well, thanks, Senator. It was certainly a busy, long session, and we appreciate you being here today. What is it? Just one day out? Is that right?
Yeah. Well, we're really not at one day, because we didn't leave the State House till about 2:00 yesterday morning. Yeah, we're into the first 24 hours, I'll say. Thank you.
All right. Well, thanks for joining us today. All right. The next thing on our agenda here, which will take up the rest of our time, is our strategic planning process. And so many of you have already met our next speaker, Robin Minton Holmes, because she conducted stakeholder interviews and things like that. So many of you were engaged in that. But I'm going to turn it over to her to facilitate our discussion on the strategic plan.
Thanks, Mike. And thanks to everybody for working with me as we have been trying to pull together what the next several years are going to look like for the council. I just want to say congrats to you for being a sector strategy for the state of Indiana. And it's exciting for me to be working with you and to hear the work that's being done. And what's most impressive is how we have such a broad spectrum that's really coming together here on the council. And so I have been singing your praises in some national meetings that I've been in, and also in some Midwest Workforce Board meetings. So I think you ultimately are a model for how to do this work. And you're going to, as we'll go through this, you'll see some of the key findings from the conversations that I had. We had 7 interviews conducted, which gave us really, I think, a pretty fair, broad perspective. So, and you'll get to see here in just a minute where we landed, which is similar. So next slide. So basically what we did in this approach is that we had 4 areas, like what's our current situation? We looked at what are our strengths? What are the possibilities of what we could do? And then what could get in the way of things that we might want to do? So underneath the current situation, you can see on the left the questions that we asked during the interview. I really wanted to kind of explore, who do the council members see as their key or primary customer? And what are the current pressures that are kind of existing on the council? And how does this work kind of happen? And basically, one of the things that didn't, not surprisingly, that came up was the impact of COVID on the health workforce. I mean, that's huge. That's been huge for all of us. One of the things I think that the council is really, and I just mentioned it, this broad approach to healthcare. There's so many different occupations, so many, kind of balls that we have to keep our eyes on. And so it is a really broad nature of what all those occupations are, as it covers, everything from mental health to physical health to, people who are working in pharmacies. I mean, I call them backroom jobs, where the billing is happening, all the way to the front where there's actual patient care. The primary customers that you talked about with me were legislators, and how you help legislators be informed on what the issues are. State agencies, how you are working with all the various state agencies. And ultimately, what we're trying to do is to create healthy Hoosiers, and also to help all Hoosiers have access to healthcare. So next. So I thought it would be good to kind of remind you of what the current situation is. So the council was established by Governor Pence, and it actually was in a press release from February of 2015. And it's been an informal group, which is interesting because we all kind of thought it was rather formal. We function as formal, we behave as formal, but where it sits and is really, like, where the council sits is really informal. That's not in code. There's not real rules about it. So I really think that in talking with Mike and all of the key informants, and also Hannah and the Bowen team, that the first thing we need to look at is kind of, where do we want to sit? That's the first perspective that we need to tackle. And we'll do that here in just a minute. And it's supported by agency discretionary funding. Hannah, where is what agencies are helping to fund right now?
The funding comes through a contract directly with the Department of Health. And so I know that there is a portion of the AHEC line item that is allocated to support the work of the council, and the Bowen Center support on that. And then I believe that there are other funds. I'm not 100% certain where they have come from.
Well, and so that's another thing to think about, right, as we move forward, is if all the agencies have an investment, see this as an asset, then I think the support question has to be brought to the table. Not today, but at some point, I think we do need to think about that. I would encourage you to think about that. It's currently chaired by the Department of Workforce Development, and just the mission is to reduce cost, improve access, and enhance quality within Indiana's health system through coordinating health workforce related policies, programs, and initiatives within Indiana. The vision is for Indiana to have a data-driven health workforce policies and a well-trained health workforce that meets the needs of all Hoosiers. So we're not going to tweak mission and vision in this strategic planning. We really, based on the interviews and our conversations, I would encourage you to accept them as they are, because I think it gives you a broad bench to launch from. So next. So really looking at what are our assets, what do we have on the table that really is going to help us weather any kind of situations that may happen now or in the future. You know, one of the things that all the key informants talked about was the leadership of Bowen Center and the value of having that attached to university. Then also there was Dr. Maxey and the staff. So they're their own asset that's brought to the table. The approach to data, there was lots of conversation around how valuable the data is that's coming out, how accessible it is, and how it's presented and how it's collected. I mean, it's very impressive. And also another asset is the makeup of the council members that I mentioned earlier, and having this broad base of key folks on the council. Next slide. So the real question is, what do we want to do? What could we do, right? Like, let's narrow this down. There's the questions on the left that we talked about. What are some of the possibilities for the work? What are 3 things we could do? What work should we be charged to do? Pretty much it all boiled down to data. And there was lots of conversation around the importance of sharing it more widely. Policy development, policy recommendations was another area that really folks found useful and want to see continue to happen. And positioning, we need to codify the organization. I mentioned this earlier, and we'll talk about what the options are here in just a minute, but we need to figure out, where does the council, what's the position of the council? It's a little free floaty right now, and could we firm that up a tad? And so another possibility is the structure. Do we want that to be a direct line out of the governor's office? And one thing that did come out is that we need a stronger connection with the governor's workforce cabinet. And so we'll talk a little bit more about that in a minute. Next. So then we talked about, what could get in our way? What are the possible disruptions? What happens if we don't have Hannah and the team? I mean, they're driving all of this. It's a huge job. And, I've seen a lot of folks try to do this work, and it's most impressive the way the Bowen Center and the Hannah and her team do the work. There currently are some siloed approaches to workforce strategies across state agencies. So, if that continues, it's going to be hard to get our arms wrapped around it. So we have to continue to figure out, how do we bring all of that into one hub if we're going to continue to be a really solid workforce sector strategy. The lack of formal codification could get in the way, the broad nature of the healthcare workforce. And what happens if there's a change in leadership? The governor could change. We need to make sure that this is solidified. And also, what would happen if there was a change in leadership of Mike or Dr. Box or anybody else who's key, folks who are on this council. And I also asked folks, who did they think were missing from the current makeup of the cabinet or council, sorry. And there were 2 that came up, AHEC and the Governor's Workforce Council representation. Just trying to, if you could add those, that may actually strengthen, what we're working on here. Next slide. So let me pause before I go into this slide. Are there any questions so far or comments? Good, maybe, I don't know. So the first step that I've asked that we really need to do today is we really need to identify which leading perspective we're going to take. We actually did some research. The Bowen Center did, Hannah and her team did research to figure out across the nation, what are some examples of where they have similar health workforce councils, and where is it positioned? So one perspective would be to connect it to FSSA, Health and Human Services. One is connecting it to workforce development. In other states, they have it connected to licensing. And then they also, in some states, they have an academic public-private partnership. So we're actually functioning, as you'll see in a minute, sort of as a public-private partnership underneath the workforce development right this minute. Would you say that's accurate, Hannah? Okay, good. All right, next slide. So here are some of the state examples that Hannah and the team found for us. In Florida, they have a physician workforce advisory council. It's underneath the Department of Health, but it's very narrow focus on the physicians. In Georgia, they have a board of healthcare workforce, and it's in the social services code, but it serves as a standalone governor-appointed board. In Minnesota, they have health or human services. It's positioned underneath health and human services. Oklahoma similarly operates from a health and or human services perspective. They have a governor's council for workforce and economic development health workforce subcommittee. So that's within the Center for Health Innovation and Effectiveness. Oregon goes up through the Health Policy Board. South Dakota, again, is in the Department of Health, and Utah has a workforce advisory committee that advises other state agencies and legislature. Oh, next slide. So another perspective is in workforce development, so that it would be seen as a sector strategy that workforce development is actually initiating. And Washington has a pretty good example of that. They have a statewide health workforce council. It oversees a network to monitor health labor needs and contributes to state workforce plans. So a big chunk of what we've actually talked here today would be similar to how this one is functioning. Okay. And then another example is underneath licensing. So in Virginia, they have a board of boards model, and it's focused on regulatory review. So you can see that different states are putting it underneath different areas in their system. So an academic public partnership. Mississippi has an Office of Mississippi Physician Workforce, and it's housed in the University of Mississippi Medical Center campus, and it's been in existence since 2012. Montana has an advisory committee. It's led by AHEC, and South Carolina also has it housed with their AHEC underneath the Office of Healthcare Workforce. So given our current strengths, possibilities, and threats, what's the best for, yes, Ken, I'll pause here. You have your hand raised.
Sorry, I didn't mean to ask a question. I must have inadvertently hit that. Sorry.
That's okay. Okay, so given our current strengths, possibilities, and threats, what's the best path forward for us? So you can see here what our strengths are, our possibilities and threats. Those are taken from the prior slides. We have ideas that it could be underneath workforce, which for us would be DWD, could be underneath health, which would be the Indiana Department of Health, could be underneath FSSA, could be underneath PLA licensing, could be external, or it could be a subcommittee of the governor's workforce cabinet. We would really still want to see other entities participating, Department of Education, legislature, the Drug drug abuse czar, and CHE, they would all be included there. So that wouldn't really change our makeup that much. So it's really important that we figure out, like, underneath these, underneath the green boxes, where we want to sit. Okay, I don't know if I'm making myself clear, but I think I am. All right. So here's an example. One of the things I just want to add is that all of the key informants interviews that I did with you really did not want to see the council buried within somewhere. So as we look at all these options, I want you to think about, where does it sit on the org chart, very technical, and which perspective do we take that allows us to still have, to still be a vibrant entity that's making a contribution, and not just tucked away somewhere where it's not really seen as, everybody didn't want that. You all wanted to make sure that you had a direct line is based, to the leader, wherever you sit. So option one would have it be as a part of DWD and workforce. It's a workforce perspective. So you can see on the left, there's the governor, there's the Department of Workforce Development, and underneath that would sit the Health Workforce Council. There would be a dotted line between the Workforce Cabinet and, I'll just say here, I don't want to waylay the conversation, but there are changes that are happening at the cabinet. And so one of the threats that we talked about earlier that was identified was change in leadership. So we don't, in one sense, it's an opportunity with the cabinet to figure out, how do we fit? How do we get them as a part of us? How do we, make sure we're on their cabinet? At the same time, it was really clear from the key informants that they did not want to be a subcommittee of the cabinet because they felt like they wanted to be careful. You said you want to be careful who's directing the work. So anyway, I just would add that little caveat there as we look at these different perspectives. The second perspective for workforce would be to actually be underneath the workforce cabinet as a subcommittee, even though I said nobody wanted it. And there was lots of caution. I think it's still an option that's on the table that you need to talk through and consider. You can see here that there's benefits. I'll tell you, you're the only sector strategy that I know of in the state of Indiana around workforce at the state level. Is that true, Mike? Yeah. And so, that's something to be very proud about. And we don't want to lose something that is one of our, biggest badges that we have. So one of the benefits here in both models is that we have sector strategy as the approach. And there's workforce expertise that's guiding the approach. And there's similar understandings around data, approach to workforce data in particular. It may have, then you can look at the challenges as you look at option one over here on the left. It may require DOL-driven focus on low to middle skills occupations. So, one of the things that I have witnessed is that you're talking about so many different occupations and a full wide range of them. And so one of the dangers would be to make sure that if you're in workforce, that you're not just stuck on this low to middle skill conversation. There is a huge need for those skills to be developed and for where we have huge gaps. I think the work that's happening with around the direct care service workers is awesome. And having adult education at the table is fantastic. So that's kind of where I'll lead this slide. Let's go to the next one. So we could be underneath the Indiana Department of Health. Now, Dr. Box, this would be underneath you, I think. And, on option one, we would ask that there be like a new commission or that it be at the level that it's not stuck under another. We want to make sure that, again, as you said, that you're connected to the right leader and you're not tucked away. So you can see here that we've put it at an equal footing with the other regulation and commissions. Option two would stick it stick it, that's not the right word, but anyway, it would position it underneath the Health and Human Services Commission. And again, the challenge for that one is reduced visibility and limited coordination with other divisions. Next slide. Then it also could go underneath FSSA. That would be one perspective that you could consider. It would support intra-agency workforce alignment. There could be some funding there. However, it may be too focused, and it's a really large agency. So, I think the question is, how do you maintain your visibility and everything you've been working on and in order to address these broad occupations and to get the word out and coordinate with other organizations, other agencies rather. And then there is the professional licensing agency perspective, which option one would put it like we would ask that there be a new health professions board, and then it could oversee these other boards, or perhaps option two has it being its own health professions board. So the benefits is it aligns well with regulatory policy. It does focus more on regulations and policies and licensure than perhaps positioning it as a wide workforce perspective, because not all healthcare workers go through the licensing perspective. Okay. And then finally, there's the academic public partnership. And so you'll see here that we are saying that it would be kind of a dotted line out of the governor's office, that there would be dotted lines to all the different agencies. It would support like cross-governmental planning, cross-agency approaches. It requires, strong footing, and I think, continuous leadership from the executive branch. We'd have to have really strong support from them. And it would still require an agency or a executive branch lead or host. Okay, next. So any potential leading perspective could share the responsibilities with other agencies through co-chairs and or funding. So, no matter where it sits, there could be two agencies that are co-chairing the council, which would help again with the broad nature. And also, I think, this idea that at some point we have to look at where's the funding for all this work going to come from. And so I think that's still on the table. But right now, what we have to figure out is, what is the potential perspective? Once we have the perspective of where we want to be, then the next thing we'll work on is what do we want to do? Because that will impact what we want to do and how we want to do it. So next. So here is the question. What do we want to do moving forward? So I'm going to open it up and for comments at this point.
So I'll comment. I apologize. I didn't have a chance to do key informant because of, I think it was
That's
session.
okay.
I would say, to be honest, I think there's a lot of value. I know nobody wanted it. I see a lot of value of having as part of the workforce cabinet. I actually don't see it being buried. I see it giving us an opportunity to elevate its stature. Also to have better support and better visibility. And just, it's also a huge governor in this current governor's initiative. So I think it would actually potentially provide it some additional resources, security, and visibility. It also would have a broader group. You might have to change the way that, who's on the cabinet and how it's done, et cetera. But I actually view that option, even though no one else did, I view the option as actually one that I think is potentially good.
Well, and I think that option's on the table, Dan. So I'm glad you made those comments. There is some leadership change at the cabinet. I don't know much about that, but I think there is some leadership change that's happening. Ed?
Yeah, I'll just echo Dr. Dan's sentiments about sending it over to the cabinet. I think there's a disconnect right now with some of the work that they're doing, and I think this could be an important way to connect the health workforce to the overall workforce efforts that are underway throughout the state.
Thanks, Doug. Senator Charbonneau? Anyone else?
No, I'm sorry. I
It's
had
okay.
myself muted. When I've been scratching all kinds of notes as you've been going through this. When was this group established? Did you say 2015?
Yes.
And one of the last things I heard was, what do we want to do 7 years later? And that troubles me.
Well, I think there's been.
Let
Okay.
me just finish.
Okay.
I think on the second slide, you had the mission of in the first, I couldn't read the whole thing, but it struck me the first thing on there was lower healthcare costs. Nowhere in any of this discussion have I heard that. I think it's important for us at this point in time to explain to maybe the governor, but definitely the legislature, what value does this organization bring? Because I guarantee you, there are folks that are going through and they're just starting to question, why do we need this? Why do we need that? Why do we need this? And if the question was asked right now, why do we need the Governor's Health Workforce Council? Maybe everybody else can, and maybe just me. I couldn't answer that question. And I think that is very, very important. What value is it that we bring to the table? And again, I don't know what that is at this point. There's a lot of activities going on, and talking about where, under what organization does it fall? I don't care. I mean, that kind of thing doesn't mean anything to me, but it does mean something that we're asking today what our mission is. And secondly, I would recommend that we quickly put together what value we have brought as an organization to the state, whether it's the governor, the legislature, and because of us. And I apologize for and I don't want to, I'm going to say it, but I know you won't believe it. Don't take this as being negative. It's not negative. It's just, I am data driven. And I would like to see the answers to those questions so that I can feel comfortable when somebody asks me, Ed, why are you on this thing? And it's very important that we get that put together, certainly before the next legislative session. So I'll stop talking. I'm sorry.
No, Senator, I value that input and really appreciate that. And to sum up some of the items, I think that through this strategic plan, we were originally formed under that original mission, and the question about lowering healthcare costs was an indirect one through how do we have a better prepared workforce that's more stable and is ready to perform, which can help providers lower those costs. But from the DWD perspective, we've seen tremendous outcomes from being better connected with our state peers on a number of the workforce initiatives. You know, a couple of years back, we did the community health worker project, which was a first in the nation to combine Department of Health and DWD and FSSA, and so. But I do hear you, and I think that is it is a valuable lesson for us to maybe catalog all of those things and try to come up with a way to communicate those.
Yeah,
Dr. Box. Oh, I'm sorry. Yeah, go ahead.
Just last thing, I think Doug kind of touched on a critical point also. There seems to be a disconnect between what's going on in everybody else out there.
Okay. Dr. Box.
Thank you. So I think that workforce is one of the biggest issues that the state of Indiana faces in healthcare going forward, whether that's public health workforce or whether that's clinical healthcare workforce for the next 10 years. And it is going to directly impact the health of Hoosiers. And so when I look at this, I feel like we are connected with the Department of Workforce Development, and yet I do not feel like we have fully integrated ourselves there and really taken advantage of even some of the workforce development grants and opportunities for healthcare professionals out there. I do think it's really important. We have lots of work going on in different areas across the state. And what I've said to the governor's team is we need to have a plan for healthcare workforce for the state of Indiana, whether that is our professionals, our physicians, nurses, et cetera, or whether it is our direct service providers. We need to stop piecemealing this and have a large plan, because Indiana does have some of the best data in the nation on this, but we aren't now translating that data into action or implementation. And so I, again, feel the same way Ed does. Wherever this is, I want to be engaged and willing to be engaged, but I do think that it is time to implement and take action on some of these things, regardless of where this lies. And it's really, really important that we get our arms around all of this. And so I think that, you know, again, I don't think it's about where this lies particularly as much as that everybody's at the table working on this and coming up with that workforce plan for the state of Indiana and then implementing that plan.
Thank you.
Hannah?
So I appreciate everyone's comments, and I think definitely it would be excellent to have, we need to have wide recognition of the value of a forum for coordination and collaboration. And I think in order for any of this work to have legs and make true impact for the state of Indiana, there has to be a formal mission and charge. And I appreciate what Dr. Box said. An example of a formalized charge would be to develop and oversee the implementation of a state health workforce plan. Currently, there is no such charge that's been formalized. And so there's a lot of ambiguity. I think there's been a lot of great conversations and connections, and potentially we could say that there's work that's come out that has directly informed legislative initiatives or helped streamline processes and enhance programs that we have here in Indiana. But those were all informally through the coordination and conversations of this group. So I definitely think there needs to be develop some consensus around what is the charge and the purpose, and then formalized moving forward, what is needed and how will an entity help fulfill that need for the state of Indiana.
Anybody else? Hannah, you did put in the chat that their 5-year review, a link to the 5-year review. Thank you.
Yeah, and if if council members have not seen that, it is a report that overviews the entire first 5 years, the topics that were discussed, any briefs or materials that came out of the work of the council, and then tying it to any actions or outcomes that we were able to track as a result of that.
And as a part of that, Hannah, I will say, I know that there have been reports done and recommendations and actions from those reports that then did not translate into implementation in those particular areas. And I know one of those was around community health workers and here at the Department of Health. So I do think that there is, and I'm not even going to say blame, but there needs to be that follow through action that occurs with this. So the data that we're getting with our licensure re-up and renewal, and will continue to expand, is incredibly valuable as we look at areas of our state that are just devoid of care in certain areas. And that is something that is going to continue to hurt Hoosiers going forward, whether that has to do with EMS in certain areas or whether that is we literally don't have a physician in that area, a primary care physician. We've got our school nurses basically saying that they are the healthcare delivery for the families in their schools. Down in Versailles, they said they had one physician who works 2 days a week. So those are the kinds of things that access to care that public health is about. And I think this is perfect timing for us to come up with this, because the Governor's Public Health Commission strategic workforce planning is going to be a big part of the recommendations that they're going to come out with, whether that's clinical or public health.
Ken?
Yes, a few quick points. First of all, I think the data gathering is really important, and I think has been a real stellar feature of the work of the council. I do resonate with the idea of being more perhaps explicit about a strategic plan that might focus on some priorities looking forward, together with some metrics with respect to how we could judge whether the implementation of that plan has been successful or not. I think there has been a lot of good work, but I do resonate with the idea that we need to focus a bit more on the implementation, on the impact, and how can we be very strategic about things that we prioritize as areas that need attention, and then establish goals and establish metrics by which we can judge whether we're making progress toward achieving those goals.
Thanks, Ken. That'll be the next thing that we do is figure out what we want to do. Once we have this kind of perspective. And, I think the other thing to consider, I said we're going to have to talk about funding, because depending upon what we want to do, we may need more money to do it. We may need staff to do it. We may, so at some point we're going to have to talk about that too, as we look at what our priorities are and what the metrics will be to show the success. So on the table, I think, Mike, there is the perspective of, remaining underneath Department of Work. I always call it DWD, Department of Workforce Development, but making sure that we are in a more highlighted perspective position. And then the other one that came up that I heard Doug and Dan talk about was the connection to Governor's Workforce Cabinet and having it be a subcommittee. So I think if you could just maybe, I think we have to make a decision, and then from there, I can work with Hannah and her team for the next steps.
So, so considering that the strategic priorities that we come up with which is the next portion of your discussion, may better inform where that might go. I wonder if we should, table this, talk about that, and then bring this back. Now, I do also recognize we have 3 minutes left. And so I think what I would suggest is that we set up an interim time because we want to make sure we give this the right amount of discourse and discussion and thought here. We would like kind of the end goal would be for the full cabinet or the full council here to approve the overall recommendations, which includes the strategic plan, where it lies, recommendations, all that kind of stuff by the May meeting. So I think it makes sense for us to maybe see if we could get a meeting on the books in early April to talk about the other pieces, and bring it all together before that May meeting. Does anybody else on the council have thoughts on that? Hannah, does that completely destroy our timeline? And
No, our team would be happy to work with Robin to see if we can set up an interim time and find availability. We recognize council members are very busy.
Yep.
Perhaps we could find an interim time that would work for the majority to continue this conversation. I do agree with you, Mike. I think that would be a good next step. Clearly,
Okay.
there was a lot of great discussion. And I think that there's opportunity for more discussion to be had to get us to a place that I think the group would need to be to prepare any type of recommendations by May.
Agreed. Yes, Dr. Box.
I also really take to heart what Senator Charbonneau said and wonder if there's value in talking to the head of the health committees directly, like Senator Charbonneau and Dr. Barrett, about a health workforce, commission and a health workforce plan for the state of Indiana and the need for that. And so, maybe just kind of running through how we're using that data and how that data can and should be used, and then kind of reviewing that 5-year report. Or Senator Charbonneau, do you think more just, giving this information to Dr. Barrett or other legislators? I don't feel like that the legislators oftentimes read the things that we give to them other than you.
Yeah, that's a good point. But I believe there is a need for that and a need to make it as concise and to the point as possible. And certainly, reaching out to Dr. Barrett would be a very good next step in the process. Yep.
Great. Thank you both for that. Good idea.
Mike, I just want to thank everybody for all their investment into this process. And it's been a time investment. And you have given, even if you didn't go to the meetings, you've still, to the key informant interview, you've still attended all these meetings and you've done a lot of work. And, it's kind of like we're ready to grow up, and I think this is an exciting time for the council. And so I'm really pleased to be working with you, and, we'll continue on our process with the team. And I think meeting again is a good idea.
All right. I don't think there's any other business that the council needs to take up today. So we will close out for today, and Hannah and team will be in touch with try to get some other times on the books here. All right. Thanks, everybody.